Thank you, Governor. Good afternoon. Thank you all for being with us today. It's always nice to be joining the Governor and the Lieutenant Governor. And today it's particularly exciting to have the honor of being with Dr. Beth Lang, who is a tremendous leader and mentor for me and for so many other healthcare providers throughout the state, as well as with the Dr. Carla Martin, who has been also an amazing colleague and provider for so many families here in Rhode Island. Having Dr. Lang and Dr. Martin here gives me an opportunity to once again thank all the healthcare providers throughout Rhode Island for your sacrifices, for your support, and for your determination to serve throughout this very challenging pandemic. The healthcare provider community has stepped up in many, many ways throughout this response. And the most recent phenomenal way that they have stepped up is during our vaccination campaign. We've shared since the beginning the number of phases that we have taken as an approach for a successful and effective vaccination campaign. We started off with a very targeted phase approach because we had limited supply, really focusing in on those who were at highest risk, and that was reflected well in having the most significant drop in our hospitalizations and fatalities compared to other states. We then expanded to the mass vaccination approach, where we've been able to get as many people vaccinated as possible and as quickly as possible and have done well. And our third phase also then tapped into meeting people where they are and really engaging in our communities hardest hit, pop-up clinics, community centers, churches, wherever we needed to be to establish a long-term vaccination approach. Our latest phase has been our vaccination policies. Where can we put in place vaccine requirements that we know are going to be effective? Where other states are getting tens or hundreds of individuals vaccinated, how can we use policies, which is a normal public health approach, to really advance what's needed with getting as many people safely vaccinated as possible? I am thrilled to be able to say that we now have 95% of the healthcare workers in facilities we license fully vaccinated. That is a clear result of the public health tool of a vaccination policy that we put into effect. Many of the remaining healthcare workers are well on their way to being fully vaccinated. That means between early September and mid-October, we saw a 30% increase in our healthcare worker vaccination rate. That is a tremendous success and really allows us to thank all the healthcare workers who understood the importance of ensuring that all patients have the right to be protected against COVID if they come in contact with our high-quality healthcare system. And then all of the folks on our team side, the Rhode Island Department of Health, our healthcare providers, our nursing home, home health agency, and hospital facility leadership, all have been working together to make this accomplishment happen. Between September 2nd and this October timeframe, we've had more than 13,000 additional healthcare workers vaccinated. We have effectively accomplished one aspect of this fourth phase of our vaccination campaign rollout from a public health perspective. Use our policies to advance vaccination in deliberate and successful ways. So that's an important approach. We want our employers and businesses to continue to take into consideration our schools, all of our critical settings, employees across the state. We can be confident that our patients and the residents in our nursing homes and other residential facilities are so much safer because of the approach we have taken and because of the high vaccination rates we have. So that is a kudos to all. So to shift gears, we want to be able to talk further about what the governor has shared. COVID-19 vaccine being available for children 5 to 11 years of age. There are roughly 80,000 children in Rhode Island in this age group, and we are ready to move full steam ahead to make sure that everything is in place so that once it's available, parents are already prepared for how to get started in getting their children in this group vaccinated. Because of the public health tools that I've shared and that we believe fully in and have shown to be successful again and again, Rhode Island has some of the best childhood vaccination rates in the country, and we fully expect to leverage what has worked so well and accomplish the same thing for COVID-19 childhood vaccination rates to be just as high as well. To share with you some of the high-level steps that have been taken, I will give you a feel for some of the things that we have been doing. We've surveyed all pediatricians and family physicians to gauge their interest in enrolling as COVID vaccine providers and have worked to get those who are interested enrolled. And so out of the 134 pediatric and family medicine practices in Rhode Island, 81 are either ready to vaccinate or are in the process of getting onboarded. We've reached out to the major health systems in the state as well to work with them to try to get their entire provider networks onboarded. And we've streamlined and simplified the process of ordering vaccines, particularly for these providers. We're also going to be doing a wide-ranging communications campaign so that parents and families understand the importance of vaccination and the many steps we'll have in place to make that available for their children and their families. I want to continue to share the context so you have a sense of what to expect. While the components of this vaccine are the same as what adults and older children are receiving, the actual formulation of the vaccine will be different for these younger children ages 5 to 11. Previously, when we opened eligibility to a new group, we could then just make the vaccine that we already have in stock available to those newly eligible people. But because this formulation is slightly different, which is very normal for the various types of vaccines that exist by age group, with children 5 to 11, the new formulation of this vaccine needs to get mass produced at the federal level, then ordered by states, then shipped to states, and then distributed throughout our state's network. Initially, all states are going to get limited weekly shipments of vaccine for children 5 to 11 based on their population size. And that's so that at the federal level, they're able to get what they have as a starting point out to everyone, all of the states at the beginning, and then continue to distribute weekly shipments beyond that. So what that means for us in Rhode Island is that we're not going to get 80,000 doses of vaccine for this population all at once right at the beginning. It's going to take time. But the good news is, by taking time, I simply mean it will take a few weeks for us to get all the doses for this population and distributed effectively. We will eventually have the vaccine that's available to cover this entire group. In terms of where people will be able to get vaccinated, we anticipate being able to vaccinate children 5 to 11 through all of our existing COVID-19 vaccination channels, which is great. That's going to continue. And with a particular appreciation to our providers, we're looking to really build on that network where so many families are already very familiar and comfortable with going to their primary care provider for their child to get vaccinated. So we're thrilled that the number of providers have enrolled in the specific requirements for allowing COVID-19 vaccine to be available within their providers' offices, while families also have the choice of going to pharmacies, to school clinics, to our state-run site at Saconaset Cross Road, and to municipal clinics. So everything that we have, plus more, are going to be the options available for families. And as we get more information from our federal partners, we'll be sure to share with you.